My name is Jan Hoy, and we do work in the Payer Relations Department, and so we're kind of in the middle of the hurricane of what's happening with health insurance. We're very pleased that you came to join us today. We hope to be able to give you some insights on what to think about when you're looking for health insurance coverage. We won't be talking about Medicare today, but we will be giving you some information on who to contact at Billings Clinic if you have questions specific to Medicare. And we also are not going to go into employer-sponsored health insurance plans. Today we're really going to be talking about the individual plans that you can get primarily on healthcare.gov, meaning the health insurance marketplace. So first of all, I'm going to validate for you that you're doing the right thing by looking for insurance coverage, because we firmly believe at Billings Clinic that it's so important to be covered so your health can be the best that it possibly can be. Staying healthy is important for you and for your family, as you know. I can remember my grandma saying, if you have your health, you have everything. You can also protect your health by getting preventive services. And the nice thing about health plans today, as a result of the Affordable Care Act, is that all of these things are part of health plans now. And many of them are free, first dollar. You don't have to meet a deductible. They're considered preventive, and they're encouraging you to get in there and get those services taken care of. Most preventive services, as I said, are free when you have health insurance and you seek that care at a network provider. And we'll talk to you about those network providers in a minute. We also think it's very important that you establish a primary care team. And when you have health insurance, it's much easier to do that. You can establish a team that you can work with that will monitor your particular health challenges, help you maintain a healthy lifestyle, can detect things early. I'm standing here because mammogram saved my life. I was able to get cancer treatment, and here I am. So I am a firm believer in getting those preventive services done. And then there's those unexpected events. It's very rare for any of us to be able to pull out $1,000 for an emergency room visit, $7,500 because you tripped on the carpet and broke your leg. It's what new young family can afford $10,000 for a new baby. And then, gosh, we might unfortunately be in an automobile accident or run into a tree while we're skiing, and who can afford $100,000? So health insurance helps you pay for your medical costs, just like your car insurance helps you pay if you have an accident, or your house insurance helps you pay if you have hail damage. So the types of services now that insurance covers are called the 10 minimum essential benefits. They range from typical outpatient care, trips to the emergency room, inpatient care when you're in the hospital, care before and after your baby's born. Mental health services are on parity now with regular health care services, a very significant change with the Affordable Care Act. You can get your medications paid for, services to help you recover, such as the different therapies that are available nowadays, lab tests, the preventive services we talked about, and then pediatric services. So how does it work? Well, just like other insurance, you pay a monthly premium. And then for that monthly premium, if you have an event that you need to have covered, a service that you have to have covered, your health insurance company pays part of that cost, and that's called cost sharing. Typically, the way it works is if your premium is higher, then the health insurance company is going to pay more and you pay less out of pocket for each of those services. If the premium's lower, then you're going to pay more upfront, or more of that percentage, I should say, than the health insurance company. So you may have heard about plans that are 80-20 or 60-40. That's what they're talking about when they say, what is the cost share between you and the health plan? There are several jargons that we use in the healthcare industry, and I'm going to explain a few of those, and later if you have questions about any of these, please ask. So a copay is typically the fixed amount that you pay when you come in for a service, a routine office visit. Typically it's a set amount, maybe $30 for an office visit, $50 for urgent care. Maybe you have $200 for an emergency room visit, but it's a fixed amount that you're paying for that service. Deductible is the amount that you have to pay out of pocket before your insurance company will pay anything. And that's why these new health plans are so nice that have certain preventive services that are covered what we call first dollar. So the preventive services, you don't have to meet your deductible. You'll get those services paid. The allowed amount's going to be paid by your insurance company without meeting the deductible. But for most services, you have to pay a certain amount out of pocket. The deductibles can range from $1,000 to $10,000, and the amount that you pay in premium is going to be adjusted accordingly. Coinsurance is kind of like a copay, but it's based on a percentage, and you're going to pay this after the fact. When you get your bill, your insurance company is going to tell you this is your portion that you have to pay in that 80-20 split or 60-40 split for a service that typically is more of a facility service or a procedure. And then the maximum out of pocket is in each plan, there is a maximum that you have to pay out of pocket, or when you reach that, I should say, then your insurance company is going to pay 100% of the allowed amount. So that protects you from having a catastrophic amount that you have to pay. I can't imagine what I would have had to pay for all of my chemotherapy, but I was capped because of my insurance coverage at an amount that after I reached that, I didn't have to pay any more out of pocket. And every plan has this as well, and it's an established amount for commercial plans that are sold on the marketplace.
We're going to switch over. So I'm Becky Kelly, and we are going to shift gears a little bit and talk about another reason. If you don't care about having insurance for your health or for financial reasons, you will pay a penalty on your tax return if you do not have health insurance. So most people are required to have health insurance for 10 months out of the year, and that is for 2017. The open enrollment, we'll talk about the timelines later. And there's a penalty if you do not enroll and have coverage for that 10 months. So the penalty is 2.5% of income, or $695 per person, whichever is greater. So the minimum amount would be $695 per person for not having insurance. There's lots of exemptions for that. If the coverage is truly unaffordable, there's a calculation for that. There are some other exemptions, but in general, everyone has to have health insurance or they face a penalty.
Is that your adjusted income or your?
Adjusted gross income, yep. So how can you get covered? There's many ways that you can get covered and avoid the penalty, and these are a few of them, and we're going to talk about a subset of these today. So Medicare is for those age 65 and older. It's also for some under 65 in very special circumstances, and we're really not going to talk much about that today at all. There's employer coverage that you might get through your employer, through your job, that would qualify as health insurance, and you would avoid the penalty. There's student insurance. If you go to college, you can get some insurance through your college, and that would qualify. There's other Veterans Administration, so VA coverage, TRICARE coverage, those qualify as health insurance so that you avoid the penalty. They don't cover everything though, so that's not necessarily the best decision for your health, but it might work to avoid the penalty. And then there's individual coverage. So if you don't have any of these other options, you can go out individually and purchase insurance, and that's what we're going to talk a lot about today. Or you may qualify for Medicaid, which is based on income, and that's for adults. So there's both the Help Plan and regular Medicaid. We'll talk about that. And then there's programs for children. So this is for those under 19, and those are Healthy Montana Kids. So there's a Healthy Montana Kids Plus and a Healthy Montana Kids, and we'll talk a little bit about those. So the rest of this talk is really focused on everything below the red line. Not really anything above. So what is this health insurance marketplace that we're talking about where you can go out and purchase your individual coverage? So what it is it's really a website, and it's very similar to, in theory, going on and looking for flights. And maybe you go onto kayak.com and you put in the flight information that you want. It brings up all your choices. It's very similar to that. This is the only place that you can go officially into on healthcare.gov, purchase insurance, and have it qualify for some discounts that you may be eligible for. So we'll also talk about that. So here is where you can shop for private insurance, or you may find out if you qualify for Medicaid or if children qualify for Healthy Montana Kids. That's through healthcare.gov. I do have a link here really quickly just to show you. I won't spend much time here. If it comes up.
There
So
you
it's a website, and you can actually, I'm going to close this. There's a lot of really good information out here. It's a great resource. So you can actually get your coverage through here. You would go in, log in, do an account, and shop. You can, without even establishing an account, you can go in and look at plans and see what you might qualify for and how expensive those would be. And then there's a whole bunch of information under C topics that explains a lot about what we're talking about today. So it's a really, really good resource. And I think it's explained in pretty easy to understand terms. I think it's a really, really good resource.
Yeah.
So I would really
Vastly
encourage you.
improved from
Yeah.
when it first started, yes.
So if nothing else, if you take nothing else away from today, go to healthcare.gov and look at what's out there. But this is the mechanism by which you can individually go on and purchase coverage. Back to our presentation. So when you go on to healthcare.gov and you go on and establish an account where it's said to go and log in and purchase, there's really two doors that you'll be led through. One is Medicaid, the Help Plan, and Healthy Montana Kids or Healthy Montana Kids Plus. So on the handout that we gave you there, these are really based on income level. So if you have certain income levels based on the size of your family, you may qualify for what's in door number 1, and you can see the different breakouts there. If you don't qualify for one of these, then you can shop for a private health insurance plan, and you can get different discounts or help with both your premium and maybe with your out-of-pocket expense, again, based on your income levels, and those are broken out on that sheet. So that's another good resource to see where you may fall and where you may qualify.
Does your account should have this year carry over to next
Yes.
year, or you have to get a new number?
So the question is, if you already have an account on healthcare.gov, does that carry over? Yes. That will always be your account. Your information will still be there. We do encourage you to go in and shop again and see if anything's changed, if there's a better choice for you, or if something for you has changed. Maybe your income levels have changed. Maybe your family size has changed. Go in and keep your information updated, but it is the same account. So also remember your login and your password. Put it in a safe place.
Question,
Yes.
does any of that involve Medicare Advantage programs?
No. So this is not Medicare. So the question is, does this involve Medicare? It does not. So healthcare.gov is for people under age 65. Medicare.gov is for Medicare. It's similar, quite honestly. It gives you shopping experience, and we also have counselors here that can help you with that. We're not going to talk about that today, but we'll give you a number here of who you can call. And we actually have a counselor here that would be able to help you set up an appointment if you'd like to do that. So Jan is going to now talk about the health plan and Medicaid expansion.
So in 2016, Montanans, in fact, many Montanans were eligible to take advantage of the Montana Help Plan and Medicaid expansion. The Help Plan and Medicaid expansion are a very low-cost coverage option for many Montanans. You qualify if your income is below $16,394 as an individual, or a family of 4 can qualify for 33,534, and like Becky said, you have a sheet there that goes into more detail. The Help Plan is for individuals who are between the ages of 19 and 64 and not eligible for Medicare. I've had that question many times. The Help Plan is not available to any Medicare eligible person. Now, there's other Medicaid programs that are available for Medicare eligible persons, but not Medicaid, not the Medicaid expansion. And of course, you have to be a Montana resident. The Help Plan, in addition to those 10 minimal essential benefits that I told you about before, also includes dental care, vision care, and transportation to appointments. And I hope you saw the little car go across the bottom. So will I save me money? Can I get a discount? Absolutely. Just reinforcing the fact that the Medicaid and Help is very, very low cost and is an excellent option for many Montanans. So there are no monthly premiums for standard Medicaid, and the Help Plan, your premium is 2% of your income. There is a low out-of-pocket cost for these plans. Medicaid has either no out-of-pocket cost or a very small copay, and the Help Plan has no out-of-pocket cost above 5% of your income. And the nice thing about that out-of-pocket cost there is that it includes those monthly premiums. And that is a big boost, because that monthly premium can add up. And so to have that add toward your total out-of-pocket cost, because after all, it is money you're paying out of your pocket, that really is a big, big help.
And I'm going to just make
yes, go
one
ahead.
comment.
Yes.
So back to the 2% of your income. The penalty is 2.5% of your income to not have it, right? So the premium to 2% of your income, again, that's for Medicaid Help, but the penalty for not having it is 2.5% of your income.
Good point. So again, this is all based on income levels, and we did our best to put that in the grid that you have about how you can qualify for either no monthly premiums or low monthly premiums. And of course, it's strategized based on what your family size is and what your income is. And this has been a very big boon to the state of Montana. I think I know there's at least 50,000 that were enrolled. 55,000 Montanans were enrolled last year as a benefit of this.
Thanks, Jan. So I'm going to talk about the private health insurance marketplace plans. So we talked about Medicaid, Medicaid Help, and now we're going to talk about the private insurance plans for adults. We'll get to the kiddos in a minute. So there's different types of private plans to choose from, and they're labeled very clearly bronze, silver, or gold. There are platinum plans, but they're not available in Montana. I don't think they're very available, really, very much in the country. So a plan will be designated as one of these levels. And so we're going to talk about premium again and out-of-pocket cost sharing. You're going to hear that a lot throughout the presentation. So in general, the lowest premium is the bronze plan and the highest premium is the gold plan. So you're going to pay more to have gold coverage than bronze coverage, but your out-of-pocket will be different. So if you don't have a very high premium under a bronze plan, you're going to have a lot of out-of-pocket cost when you actually go and seek medical services. So it's kind of the inverse. So you either pay every month a lot, and then you get really good coverage when you seek services, or the reverse. So the cheapest plan does not always get you the best coverage for you, depending on your needs. There's also the ability to get some help with cost sharing, the out-of-pocket cost sharing, so the deductible, the co-insurance, et cetera. if you buy a silver plan and you're within a certain income level, and that's also on that sheet there. So if you can qualify based on income for out-of-pocket cost sharing, you can only get that if you buy a silver plan. So really it's this balance as I talked about. So normally as the premium is lower, the out-of-pocket cost is higher, and vice versa. If you pay a lot of premium up front, you probably get better coverage when you go to the doctor or the hospital. And so you really have to figure out for you what is the best choice for you and how you use healthcare. If you have a chronic condition, if you have a lot of medications, you need to make the best choice for yourself. So just because your neighbor bought a certain plan doesn't mean that's the right plan for you. So on a private health insurance plan, can you save money? Can you get a discount? And the answer is maybe, but many Montanans do qualify for some help to purchase individual coverage. You have to buy it through healthcare.gov, through the health insurance marketplace to get any of these discounts. And there's very good potential that you'll get a discount on your monthly premium. That's called a tax credit. It's a certain level based on your income, and it will help you pay or reduce the amount of monthly amount that you would owe to purchase that health insurance plan. You can also get a reduction in your out-of-pocket cost, remember, if you buy a silver plan and you are within a certain income level. So there's a way to save on both, again, depending on income level. And here are those income levels. So you may qualify for lower monthly premium at these levels. And you may qualify for lower premium and lower out-of-pocket cost at these levels. But again, only if you buy a silver plan can you get the out-of-pocket cost reduction. Here's the kiddo part. I think you're going to talk about the kids.
I am.
Question?
One question for you. In our circumstances, we've got one person on Medicare and one person underage.
Underage.
How does, when they look at your overall income, do they look at your social security income as well?
It's how you file your taxes.
Okay.
So the question is, if you have one person on Medicare, one person on other coverage, how do they look at the income? It's your family income on your taxes, modified adjusted gross income.
Right. So when we're seeing those numbers, like it was 4764, that's where you fall.
Right.
You look at.
Right, so these numbers, and really the grid gives you more information. So that would be, in theory, a family of two, right? And so you would be looking at those income levels, even if you're only buying single coverage.
And the nice, I'm just going to add on to that. The nice thing about healthcare.gov is when you put your income in there, it does all the automatic calculations for you and helps you find how much you are, what your subsidy could be and all that type of thing. So it's very interactive in that, and you can actually change it. It gives you, this is what to include, what not to include. So it's much more user-friendly than it used to be.
That's
So
all
yes.
based on 2016 income, right?
Well, actually, you project what 2017 is going to be. And then that's why Becky said that you need to go in on a routine basis and update your account, because if any of that changes, that it could change the impact on your tax subsidy and all of that kind of stuff. This is one of those untold stories, I think, that in the state of Montana, we are very fortunate to have Healthy Montana Kids and Healthy Montana Kids Plus, because I would say that most children qualify for lower cost health insurance, if not free health insurance. And you can find out about this on healthcare.gov. By putting in your family situation, it will guide you as to whether or not your children qualify for Healthy Montana Kids or a discount on private health insurance. They're low-cost coverage, and again, it's all based on income. So children can qualify for HMK Plus with no premium and no out-of-pocket costs based on these income levels, and children can qualify for HMK and no monthly premium and low out-of-pocket costs at these income levels. So it's really worth a family checking out what is available to them in the state of Montana based on what our average gross income is in the state. Children have to be under the age of 19, and they, of course, have to be Montana residents. If you have Medicare, do you have to do anything with the healthcare marketplace? Do you have to do anything on healthcare.gov? No, is the answer to that. But I know many of you may have questions about Medicare-related issues, and we do have a resource here at Billings Clinic. Please call our Patient Financial Services Department at 406-238-2601, and they would be happy to help you because we have what's called SHIP counselors, and one of them is sitting right over there. There's Shannon Long. She is both a certified application counselor as well as a SHIP counselor and can give you guidance on some of your Medicare questions.
So you want health insurance, you qualify, you're on healthcare.gov, you think you've picked the plan, does it include your doctor? So this is another really important consideration. And so you'll hear a lot about what a provider network is. So what is a provider network? So a provider network is a group of all kinds of doctors, pharmacies, et cetera, hospitals that come together and contract with the insurance company. And through that contract, they are considered in-network. So you'll hear provider network, you'll hear in-network. But some providers maybe don't sign the contract, and they're out of network. So as we've talked about all of these things about co-pays, about free preventive services, et cetera, those only really apply if you go in the network. So if you have a desire to stay with your current physician, establish at a certain place, or you know you're going to need care somewhere, you really want to make sure that that provider group or those providers are in your network, and those plans on the marketplace do not all have the same networks.
If your doctor's in Billings Clinic,
Yes.
would that mean, so if I pick him and Billings Clinic is in my plan, would that mean that he's covered in that?
So the question is, if I pick Billings Clinic, and Billings Clinic is in the plan, is the doctor in the plan? Yes. And I'll tell you which ones those are in 1 minute.
Okay, sorry.
So, that's okay. So less out-of-pocket cost, much less out-of-pocket cost. The out-of-pocket cost, if you go out of network, might be 4 times as much. It might be a $20,000, $30,000 deductible, and there might be no coverage at all, actually. And again, most preventive services that are free, as we've talked about, are only free if you go in the network. If you go out of network, they will not be free. So here's the Billings Clinic story. We are in network on healthcare.gov in those plans for these. Blue Cross Blue Shield, all plans. Pacific Source, all plans. The Montana Health Co-op, Access Care. The Help Plan, Medicaid, Healthy Montana Kids, Healthy Montana Kids Plus. So if you pick any one of those plans, bronze, silver, gold, we're in, and it would be at the highest level of benefit. But we are out of one plan. We're out of the Montana Health Co-op Connected Care Network, and any plans that say Connected Care, Billings Clinic is not in, and you will have a very large bill if you seek services here, up to 100% of our charges. So it's really important that you look at not just the plan design, what's the best premium and benefits for you, out-of-pocket cost sharing, but also the provider network. So before you enroll, make sure that your favorite doctors, hospitals, clinics, et cetera, are in the network. Also make sure your pharmacy is in the network. If you have a pharmacy that you really want to go to, make sure it's in network or you won't be able to access it. Blue Cross Blue Shield is not contracted in 2017 with CVS pharmacies. So if you were to buy a Blue Cross plan and then try to go to CVS, you can't go. So it's really important that you look and make sure that where you go for pharmacy is in the network. And then, yes?
She has a question, I
One
believe.
question. Anesthesiologist.
This seems like different. When you do surgery, you think all doctors and all the same, you know, same, but anesthesiologist is different.
Right, so at Billings Clinic, we partner with a group called Billings Anesthesiology. So they are not a part of Billings Clinic, but they participate in all the same plans we do.
So they in their field, they do different.
Right,
They'll
right.
get separate. Bill.
It'd be a separate bill, but it would all fall under the same in-network, same coverage. So medication coverage. So there's something called a formulary. So what's a formulary? A formulary is a list of medications that are covered. And they're normally covered at different tiers. So there might be certain medications that are considered tier 1, and you would pay a very small amount. It's often a copay. Sometimes it's a deductible or coinsurance, back to those terms. If you have a tier 4 or 5 medication, those can be quite expensive. And so if you have certain medications that you take, you would want to look at the formulary of each of those plans to get a good idea of how much it might cost you to stay on those medications under different plans. And those formularies are, you can look at them on healthcare.gov, I believe,
yes.
and then also on any of the plan's websites. And so, again, you want to look at your medications, what you take, are they on the formulary, and how much would you have to pay for those, and then can you go to your favorite pharmacy to get them, right? So provider network, formulary. Really important concepts as you look at your plan choices. Jan?
Well, so I bet you guys already know the answer to this question. If you think about it, can you get car insurance after you have a car accident? Can you go get house insurance after the hail? No. So in most cases, insurance coverage is not retroactive. So that's why it's really important that we keep in mind the open enrollment periods. The current open enrollment period for commercial insurance, individual insurance, started November 1st and goes all the way through January 31st. And again, it's called open enrollment. Now, there's always exceptions. So people who have Medicare, if you can qualify in the month you turn 65 for Medicare. You can qualify, honestly, for Medicaid or the Medicaid Help plan at any time. And if you have a change in your income where your children didn't qualify for Healthy Montana Kids before, they could become eligible at any time and be enrolled in Healthy Montana Kids. And then there's also exceptions, what we call special enrollment periods, that are available for people with the commercial insurance from the healthcare marketplace that we call life changes. So maybe you have a job change and you lost your insurance, or you move out of the state because every state has different plans. You've got married, you had, even if you have a baby, you have an opportunity to get family coverage that you didn't have before. So it's something that going to healthcare.gov can answer those questions. Can you change the insurance plan you already picked? Well, you might be able to, and again, is it during the open enrollment period? So they're very important dates. Now for Medicaid Help, it's a little different, honestly, because the first day of available coverage for Medicaid Help plan was last January. So if you go and you seek out health enrollment in a health plan today, and you find out that you are actually eligible for Medicaid Help, it could be retroactive for you, and it could go back as many as 3 months. So that's different. That's Medicaid Help, and that's a very specific instance. And certain Medicaid plans are also retroactive in certain instances. So just wanted to point out to you that, and this was important for people to understand, that Medicaid Help is available year-round. But regular health insurance is only available during the open enrollment period, and this year it's November 1st through January 31st, as I said. But the last day to enroll in plans for coverage to begin the 1st of January, so you have a full year, is December 15th.
So who's confused? Yay! Do you have a question or are you confused?
I do have a question. I was just notified, I've been disabled for 2 years. And I could not go on Social Security because I was not old enough. Well, now I just got a letter from them that said, congratulations, you get to go on Medicare. Okay,
Medicare?
Medicare.
Okay.
So I have a meeting with Lions because, I don't know, I suppose everybody in this whole room is very intelligent when it comes to insurance, but I'm not. So I'm going to talk to them and find out, but now you're talking about deadlines. My appointment isn't until December 13th, so am I past the deadline?
Well, you're eligible for Medicare now,
Starting January 1st.
starting January 1st. So his question is, he's eligible now for Medicare. His appointment isn't until after December 15th,
Correct.
right? And his
13th.
December 13th, your coverage will start January 1?
Yes,
Medicare?
yes,
Okay. So none of this actually really applies to you.
okay.
Because
That's what they said too, but I don't
you
want-
won't qualify for Medicaid help because you can't be Medicare eligible to do that. These private insurance plans really don't apply because you'll be on Medicare. But you will have the opportunity to get some supplemental coverage underneath your Medicare plan to help. But again, that is not impacted by any of these dates.
Okay.
Okay?
Thank
Good.
you.
So, this is confusing, how can I get help? So, there's lots of places. The biggest place to get help for individual questions, because you all have individual situations, is to visit with one of our certified application counselors. So Shannon is one, we have several. They do take appointments. She's here today if you want to sign up for an appointment. And there's the phone number again, 238-2601. And then there's lots of information on different websites. So we have a website, billingsclinic.com/marketplace. There's a lot of this information. This video will be posted. We have answers to questions.
Insurance Finder, too.
Insurance Finder, I didn't mention that back on that slide about provider network. So billingsclinic.com/insurance finder will give you the list of the plans we participate in, where we're in network, and give you the ones where we're not in network. And that is updated as changes occur, so that's another good resource. Healthcare.gov, so that's the website we showed you, so that's the official place to go sign up. But it also has a lot of good resources. CoverMontana.org, CoverMT.org has a lot of good resources, and MontanaHealthAnswers.com. These are all, with the exception of Healthcare.gov, of course, which is a national website. All the rest are local or in the state of Montana and are very Montana specific.
And may I mention, as far as finding local help, there are links on all of those websites that allow you to put in your zip code and find where the help is closest to you. So if you don't live right here in Billings, maybe you live in Laurel, maybe you live outside Yellowstone County, you can put your zip code in on Montana, covermontana.org, as well as actually healthcare.gov has find local help. And then maybe you'll find someone that's closer in your community that could help.
And we're not the only ones that have assisters at Billings Clinic. There are others in the community, and then there are several outside of the community if you live outside of Billings.